If you're anything like us, your furry companions, well, they're more than just pets. For so many of us, they're family.
Absolutely.
And when it comes to family, their health.
Yeah.
It's right at the top of the list, isn't
It's
it?
always.
So today we're taking a deep dive into the really dynamic world of small animal veterinary medicine.
Mhm.
We're focusing specifically on the kind of care available for our dogs and cats.
That's right. And our discussion, it's grounded in a pretty comprehensive study guide that details, the latest changes and key things to consider in the field.
Mm,
It really highlights just how fast veterinary science is moving. It's quite incredible.
yeah, it really is. So our mission today, we want to pull out the most important nuggets of knowledge from this material.
Okay.
We'll zoom in on recent surgical breakthroughs, the common health issues every pet owner should really understand, and also those significant ethical questions veterinarians face every day.
So top to cover.
Yeah. Think of this as like your shortcut to getting truly up to speed on the cutting edge of pet care.
Sounds good.
So let's kick things off where some of the most dramatic changes are happening. I mean, the operating room.
Yeah.
These new surgical techniques.
Yeah.
They genuinely seem to be mirroring human medicine now.
They really are. And the goal is always, always the same. Make procedures less invasive for our pets
Right.
and get them recovering faster, back on their paws quicker, you
Yeah.
know?
Back on their paws.
And that leads us straight into minimally invasive surgery or MIS.
MIS, okay.
Yeah. And look, this isn't just a small tweak. It's a fundamental shift. We're treating pets with the kind of advanced, compassionate techniques we expect for ourselves now.
So what does that mean in practice?
It means smaller incisions.
Yeah.
Much smaller, which translates to less pain, quicker recovery times,
Makes sense.
and even less scarring for the animal.
Mm.
Take abdominal procedures, for instance. Things like routine spays,
Mm.
or even dealing with male dogs where a testicle hasn't descended. That's called cryptorchid castration.
Oh, okay.
Laparoscopy is now very widely used for that. It's also key for preventative surgeries, like a prophylactic gastropexy.
That's the one to prevent bloat, right, in bigger dogs.
Exactly. That life-threatening stomach twisting. Laparoscopy is great for that, and also for things like liver biopsies or, getting out foreign objects they've swallowed.
That's incredible. So MIS is clearly transforming things in the abdomen. But are there limits? I mean, areas where maybe traditional open surgery is still better.
That's a really good question. Yes, absolutely. While MIS is expanding incredibly fast, traditional open surgery definitely still has its place,
Okay.
particularly if you need very wide access or for really complex resections where you need to remove a lot of tissue. But honestly, the scope of MIS is already impressive.
So beyond the abdomen.
Oh, yeah. For the chest cavity, we use thoracoscopy. That helps treat things like pericardial disease around the heart or for taking lung biopsies.
Wow.
And for joints, arthroscopy. It allows for incredibly precise diagnosis and treatment of issues like elbow and shoulder problems or cranial cruciate ligament rupture.
That's like the dog version of an ACL tear.
Exactly like an ACL tear in humans. Arthroscopy fixes that with minimal trauma. And there's even cystoscopy going into the urinary or genital tracts, often without any incisions at all for diagnosis or minor procedures.
And underpinning all this precision, I guess, is the imaging technology. You mentioned high-res ultrasound, CT, MRI.
Mm-hmm.
How much has that really changed the game for surgical planning?
Oh, it's revolutionized it completely. These tools give us such detailed pictures of what's going on inside. That's essential for just getting the diagnosis right, obviously.
Sure.
But the real game changer is how they inform the planning. Vets can map out complex surgeries with unbelievable accuracy beforehand.
A roadmap.
Exactly. And now there's even real-time 3D imaging and intraoperative imaging seeing inside during the procedure. It's like having a highly detailed GPS guiding every single step.
That level of precision must also be driving progress after the surgery too, right? In recovery and long-term health.
You're absolutely right. We're seeing really exciting things in regenerative medicine and rehabilitation.
Like stem cells.
Exactly. Stem cell therapy and platelet-rich plasma, PRP, they're being used more and more to boost the body's own natural healing, especially good for orthopedic injuries and chronic stuff like osteoarthritis and post-op recovery. It's not just about rest anymore. We now have comprehensive rehab programs. Think hydrotherapy.
Underwater treadmills.
Yep. That, neuromuscular electrical stimulation, laser therapy, these things genuinely accelerate healing and improve mobility. They get pets back to living their best lives faster.
And speaking of orthopedics, bones and joints. The progress there sounds almost sci-fi sometimes, custom 3D printed implants.
It does sound like it, but it's real, tailored exactly to the animal's anatomy. Imagine a perfectly fitted custom part for a broken bone, like you said, like designing a specific component for a machine.
Incredible.
And for fractures, modern locking plate systems. They're like advanced internal scaffolding, much more stable, leading to faster, more reliable healing, even for really complex breaks.
And those common knee injuries, the cruciate ligament tears.
Yeah, the CCL injuries. Procedures like TPLO, tibial plateau leveling osteotomy, and TTA, tibial tuberosity advancement, they've totally revolutionized treatment.
How do they work, briefly?
They essentially change the physics of the knee joint, re-angling it so that torn ligament isn't needed for stability anymore. It's very effective.
Wow.
Plus, we're even starting to see robotics used in some complex orthopedic surgeries for, enhanced precision and control.
It all comes back to precision.
It really does. And all of this is supported by better patient care and monitoring overall. Advanced pain management is huge now.
More than just pills, I assume.
Oh, definitely. We're talking local nerve blocks, long-acting local anesthetics injected right where they're needed, and these comprehensive protocols called ERS Enhanced Recovery After Surgery to really optimize comfort after the operation.
Okay.
We use soft tissue lasers during surgery, too. They reduce bleeding and swelling, which helps the surgeon see better. And wearable tech, little monitors that track health metrics before and after surgery, giving us constant insight into how they're recovering. Then there's telemedicine for remote specialist consults, and even specialized diets designed to help build muscle mass during recovery.
It's just quite something to think about how all these improvements directly help our pets and us, their owners. The options are just worlds away from what they used to be.
Absolutely. Redefines what's possible.
Okay, so from that really high-tech surgical world, let's shift gears a bit. Let's bring it back to the things that impact every pet owner every day. Common health concerns and just general health monitoring.
Right. The day-to-day realities.
This is where those annual health exams and maybe more frequent checkups for some pets are just so critical.
You're absolutely right. And the landscape of common health issues, it's not static either. It's constantly shifting. We're seeing both emerging and re-emerging diseases.
Okay, like what?
Well, on the viral front, there's feline morbillivirus. It's now suspected as a potential cause of kidney disease in cats.
Interesting.
Then canine circovirus, found in dogs with gastroenteritis, though we're still figuring out its exact role. Canine influenza, specifically the H3N2 strain.
I've heard of that one. Didn't it come from birds?
It did, avian origin, spread to the U.S., and interestingly, it can even infect cats.
Wow, okay.
Then there's feline calicivirus, which is super common, often pops up with other viruses, and it can become latent, hide in the body, and flare up later.
Nasty.
And quite worryingly, avian influenza, H5N1. There have been cases reported in cats linked to dairy workers and also contaminated raw pet food.
Oof. That raises bigger public health concerns too, doesn't it?
It absolutely does. Big concerns for both animal and public health there.
So those are the viruses. What about bacterial issues?
Right.
Especially the ones that can, jump between species. That always worries owners.
It's a valid concern. We call them bacterial zoonoses. Rabies is the classic example.
Yeah.
Rare now because of vaccines, thankfully, but still fatal.
Right.
Then there's MRSA, methicillin-resistant Staph aureus, which can pass between pets and people. Leptospira species, that's an emerging bacterial threat. Bartonella henselae.
Cat scratch disease.
That's the one. Transmitted by fleas. Causes fever, swollen lymph nodes in humans. And of course, common gut bacteria like Salmonella or Campylobacter can definitely spread from pets. And it's not just bacteria. We're seeing some re-emerging parasitic and fungal diseases that can also be zoonotic. Things like echinococcosis, leishmaniasis, onchocercosis, sporotrichosis. Some are more common globally, but it shows how connected health is worldwide.
Which leads us right into parasite control. That's just an ongoing battle, isn't it?
Yeah.
The forecasts seem to say parasites are spreading more each year.
They are, unfortunately. Climate change and animal movement play roles. Heartworm disease is a huge one.
Spread by mosquitoes, right?
Yes. Serious, potentially fatal,
Yeah.
requires regular testing and, crucially, preventative medication year-round in many places.
And the usual suspects, intestinal parasites.
Always a concern. Roundworms, hookworms, whipworms, tapeworms. Some of those are zoonotic too, another reason for regular prevention and deworming.
And as our pets are living longer, thankfully, we're dealing more with age-related issues in senior pets.
Definitely. That's a growing area of focus. Weight control is critical.
Gain or loss.
Both, actually. Weight gain increases risks for things like arthritis, diabetes, heart disease in older dogs. But unexplained weight loss is a big red flag, especially in senior cats, could signal underlying disease.
Right.
Older pets also tend to have weaker immune systems. They're more vulnerable to infections, and their vaccination needs might change too.
And mobility.
So-
Arthritis seems so common.
Incredibly common. Stiffness, difficulty getting up, reluctance to jump. Those are classic signs.
It's not just their bodies either, is it? Sometimes their minds seem to change too.
That's a very important point. Cognitive dysfunction. It's similar to senility or dementia in humans.
What does that look like in a pet?
Disorientation, changes in sleep-wake cycles, maybe forgetting house training, interacting differently with the
It
family.
must be hard for owners to see.
It is. And for pets that aren't spayed or neutered, the risk of certain cancers, breast, testicular, prostate, goes up significantly as they age. And then there's the list of other common senior issues. Heart disease, kidney disease, urinary tract problems, liver disease, diabetes, and of course, gradual vision and hearing loss.
So beyond the senior-specific stuff, we still see plenty of the regular diseases too.
Oh, absolutely. Ringworm, that's actually a fungus, not a worm. Upper respiratory infections like kennel cough, which can be viral or bacterial or both. Mite infestations like demodectic mange or the really itchy sarcoptic mange. And sadly, feline leukemia virus, FLV, and feline immunodeficiency virus, FIV.
Immunosuppressive ones.
Exactly. And canine parvovirus, still a deadly threat for unvaccinated puppies and dogs.
Wow. It's a lot. This whole spectrum really hammers home why it's so important for you, listening as a pet parent, to stay vigilant, stay informed about your pet's health.
Vigilance and partnership with your vet are key.
Okay, let's shift one more time. This is a really important area. The complex, often tricky ethical dilemmas that come up constantly in veterinary practice.
Yes, this is huge. And it's deeply tied to how our relationship with companion animals has changed.
How so?
Well, there's this concept of the evolving human-animal bond. Pets are increasingly seen as true family members.
The pet humanization trend.
Exactly. And with that comes, naturally, much higher expectations for the level of veterinary care provided.
Right. People want the same level of care for their pet as for themselves sometimes.
Precisely. And this forces veterinarians to navigate really complex emotional and psychological dynamics with owners. You're balancing the best medical path with an owner's deep emotional connection, their hopes, their fears.
And it's not just the emotional side. The technology itself adds another layer, doesn't it? All those advanced treatments we talked about, oncology, transplants, dialysis, they allow for amazing things, but do they complicate the ethics?
Immensely. They raise this fundamental ethical question: quality of life versus simply prolonging life.
The really tough one.
It is. It's incredibly challenging for vets to figure out when continuing treatment is truly in the animal's best interest versus when it might just be extending suffering, especially with very old or chronically ill pets.
And owners might be too emotionally close to see it clearly.
Understandably so. A huge part of the vet's role is guiding clients through those incredibly difficult conversations and decisions, always trying to advocate for the animal's actual well-being.
It's worth remembering, too, that controlling pain and distress, that wasn't always a given in VetMed, was it?
Not at all. Historically, it was often overlooked. Now, it's rightly seen as an absolute ethical necessity, a core part of care. That's a massive philosophical shift.
Yeah, a really positive one.
Absolutely. This also connects to the challenge of balancing competing interests. Meaning sometimes what's medically best for the animal might clash with what the owner wants, or perhaps more often, what they can realistically afford.
The financial constraints.
Exactly. Ethical frameworks are vital here. They help guide vets in making decisions that prioritize the animal's welfare while still respecting the owner's situation and autonomy as much as possible. It's a delicate balance.
Which underscores the need for really good communication and professional responsibility.
Totally. Vets have that fundamental duty of care. That includes clear, honest, empathetic communication with clients. It includes sound ethical reasoning to try and prevent poor welfare outcomes. It's about building that partnership, creating personalized plans.
Improving that dialogue, really.
Improving the dialogue is key. And this ethical lens, it even extends to breeding.
How so? Breeding ethics.
Yes. It covers everything from responsible reproduction, the welfare impact of certain pedigree breeding practices.
Like breeding for extreme features that cause health problems.
Precisely. It also covers sterilization decisions and even touches on controversial areas like cloning. There's a strong push now for health-conscious breeding. meaning prioritizing health and temperament over just appearance, and really using genetic testing smartly to screen for and control hereditary diseases, trying to breed healthier animals overall.
That makes a lot of sense. Finally, we can't really talk about the ethics of the profession without mentioning the people in the profession, right?
Yeah.
The well-being of vets and vet techs.
Absolutely crucial. The challenges facing veterinary teams worldwide are significant: compassion fatigue, burnout, financial pressures, the emotional toll of euthanasia.
It's a tough job.
It really is. There's a growing and much needed focus on supporting mental health and well-being within the profession. It just shows, this human-animal bond. It creates this incredibly complex ethical landscape that affects everyone involved. It's not just sentimental, it's profoundly ethical.
What a journey we've taken today,
Right.
seriously. From those incredible leaps in surgical techniques, the constantly changing picture of pet diseases,
Right.
all the way to these deep ethical considerations that really form the foundation of modern veterinary care. It's so clear this field is anything but static.
It really does highlight how dynamic veterinary medicine is, and as a result, how the complexity and the responsibility of being a pet owner keeps increasing, too, with all these advancements.
Yeah, our role as pet parents today is definitely more informed, more involved than it's ever been.
Without a doubt.
So, we want to leave you with a final thought to ponder. Given all these incredible advancements we've discussed and all the nuanced ethical considerations, what aspect of your pet's future health care are you most optimistic or concerned about?